Hi, my name is Lakeisha Thompson. I am from Maryville University and I am in the Student Nurse Practitioner program for adults. And I'm going to do an abdominal assessment on my patient here today. So first we will start off with the inspection process. We're going to actually look at the patient and just look at the contour of his abdomen. Also to check to make sure that it's symmetrical on both sides, that his umbilicus is inverted, and that it's midline, and currently he has more of a rounded abdomen. I'm going to have him lay back on the couch, so to speak. So if you want to lay down for me. We will continue with the inspection process. So as I'm noticing here, he is completely midline. His color does not show me any signs of cyanosis, any ecchymosis, any types of masses or lesions or nodules by looking. I'm going to have you hold your breath for me. Take a deep breath. Okay. And again, not seeing any change in smooth or you can go ahead and take a breathing. Smooth or any changes in his stomach that way, contour-wise. I'm going to have you lift your head up for me. Okay, you can lay back down. Again, I'm just looking to see if I see any masses or maybe a hernia or anything that would show once it's displaced from him moving his abdominal muscle there. So all of that appears to be good. And then we will move on to the auscultation portion of the exam. So I'm going to go ahead and listen to him in all four quadrants of his stomach. I'm going to start with the right lower quadrant. And with the diaphragm, his right now in auscultating all four quadrants of his abdomen, he does have positive bowel sounds, or an audible and normal reactive. I'm going to now listen with the bell just to check for any pulsations or bruits. And in listening to all of his aortic and kidney and also his inguinal and also his femoral arteries, all of them were negative for any bruise. So we will move on to the percussion portion of the exam. I'm going to percuss all of the quadrants as well as percuss his organs just to check for size. We're going to start off first with just percussing in his upper quadrant here. And just seeing the change in percussion, you're going to want to check for his liver, and we're going to check his size. It should be about 1 centimeter lower than his costal area, and it should also measure between 6 and 8 inches. So I'm going to start actually from the lower portion of tympany and work my way up to hearing dullness. And then from that part, I'm going to mark it. And then I'm also going to start then at mid-clavicular line at the very top here, and listening from resonance to dullness, and mark that. And then we will actually, let me grab my measuring tape. And we will measure that, and that should be between 6 and 8 centimeters. And it is actually 8 centimeters. And then we will also go ahead and percuss for his spleen, and it'll be more of your mid-axillary line on the left-hand side. Same idea. This obviously takes some practice to get really good at it. And that's usually also found around the 5th and 6th intercostal space. And so there's that. And then we will go ahead and just check while we're looking too, and percussion wise, we'll just make sure that you can't feel any other of his organs as you're going. Or any difference in change of sound, and I couldn't hear anything. Most of his stomach sounded timpani, and then over the areas of the organ sounded dull, so it is what it sounds. Then we'll move on to the palpation portion. I'm going to start out with light palpation. And I'm sorry, before we move on for percussion, I'm just going to go ahead and percuss the CVA to check CVA tenderness in his kidneys. If you wouldn't mind sitting up real quick for me just a little bit. So you're going to go ahead and indirectly hit the back of the kidney area just to make sure that you don't have any tenderness. And did you have any tenderness with that?
No.
Okay. And then if you can just lay back on the thing for me. I'm going to go ahead now and just palpate and do light palpation first. And we'll start off with his stomach. We always want to start off with doing inspection and auscultation before you move on to percussion and palpation, because it can change the sounds of the stomach, and we can move obviously for peristalsis and everything, so we don't want to change any sounds. So we'll go ahead and start out with his light palpation. We're just going to see if we can feel for any nodules or any masses. Make sure the patient isn't having any pain during palpation. Are you having any pain or tenderness when I'm doing this?
No.
Okay. So once we get on from light palpation, we go on to more of a deeper palpation. And when you're doing the deeper palpation, you also want to try to feel for some of the organs. So after I palpate actually all of his quadrants, I'm going to go ahead and try to feel for his liver. We'll start off and we'll push up from here. We're going to go ahead and push from the back and push up. And see if we can, I'm going to have you take a nice deep breath. And that should actually, and you can go ahead and remove that. That actually lowers the liver a couple centimeters. And then we'll go ahead and do the same thing over here for the spleen. And as pushing back from the flank up, you should feel the spleen kind of come up. You don't want to feel the spleen or the gallbladder. We're also going to feel for the left and the right kidneys. So as I'm doing this, I'm trying to see if I can feel for his kidneys. Sometimes they say you can feel the right more than you can the left. And then you also want to, one thing I did forget to do too is check for the gastric bubble. So I'm actually going to percuss for that as well. And that should be higher tympani than you hear with normal. And I did feel for that. I also want to check his umbilical ring just to make sure that that is round and it's not protruding, and that looks good as well. And I'm also going to check his aorta when I'm palpating and just make sure that I don't feel any abnormal pulsations when I'm doing that. Otherwise, that also is cause to check again. And I don't feel anything there. So all in all, I think it turned out to be a good exam and not having any pain at all.
Okay.
And I don't see any, when I'm looking at him, I didn't see any difference in his contralateral sides, no bulging, any difference in shape or size or contour. So I'm not concerned at this point for him to have ascites. He's also not complaining of any of bladder pain, so I'm not going to palpate his bladder at this time. And before this exam, I asked him to urinate so that his bladder was not full during this procedure. And I also made sure that my stethoscope was warmed prior to, and the patient did have a pillow to kind of help with the exam as well, and to be more comfortable and relax his abdominal muscles. So I appreciate listening to my video, and everyone have a good night. Thank you.